You have a child that you are trying to keep out of the ER because they are dehydrated, they're not even taking popsicles, or they've got a medicine that they have to take, say for an ear infection, that they will not take. They're clamping down, they're pursing their lips, they're spitting the medicine out at you. What can you do? I've got a tip. Try this before you give up. 2 things you need. A medicine syringe for obviously giving either the water or their medicine, and then another adult, ideally to help you if you can. You want to use what's called the knee-to-knee position to deliver this medicine. I'll show a little demo of that here. At the adult, this is going to be you on the left side, the dentist, and then the other adult helping you hold their hands, feet. If they're kicking, moving, they can even help support their head. You are in that dentist position. You're going to be the one not brushing their teeth like in this demo, but giving the medicine, and I'm going to show you how to give that. And no, you don't have to lay them all the way back like they would for a dental exam. You can have them reclined on like a pillow. They only have to be semi-reclined just so that you can see easily. It might help them swallow that liquid a little more easily. I'm going to show you where you're giving this medicine. It's a little trick. It's called a retromolar pad. So if your child, one, is pursing their lips, you can use the syringe or your finger to squeak in between their lips and then run your finger along their cheek. They're not going to bite you if you stay on their cheek. Move with them if they move. They can't bite you, see? Ow. We'll try it with a syringe. There you go. And where you are aiming is back here. This little triangle of tissue is called the retromolar pad. Now, if you need them to open a little, you can put pressure there, push down on that back gummy pad, and they'll open a smidge, like this. But you're really just aiming in that spot, the retromolar pad area, so that you can turn that syringe so it aims toward their throat and inject about 1 milliliter of liquid for them to swallow at a time. So here, see how I turn it? And it's sitting back behind those molars, and I'm just going to squirt toward their throat about 1 milliliter at a time. They will reflexively swallow when they're back there. Now, if some of it comes forward, they try to spit. Here's the trick that stops spitting. You retract their lips out. Try this yourself. You'll feel really stupid, but you'll see they cannot spit if you're stretching their lips out. So like this. They can't spit it. So you inject that medicine, get their lips, and they will swallow that medicine. Now, obviously, this is not the goal. The way to avoid having things like this is to practice before it is necessary, before they're not able to compensate, before they're sick and about to go to the ER. Practice with water in a syringe at mealtime, play doctor, play sick, and pretend to give medicine in that area a little bit at a time and praise them for a good job. But if you're in dire straits, you want to keep out of the ER, this is a way to get medicine, to get hydration into your child safely.